Good morning.
Good morning.
Hi, my name's Adam. I'll be your nurse today.
Hi, Adam.
What is your name, please?
My name is Carl Evans.
Your date of birth?
August 1st, 1993.
Do you know where you are right now?
I'm at Wellington Regional Hospital.
Okay. Let's see how you're doing. Have you ever had any type of breathing reaction like this before?
No.
Have you been sick lately?
No.
Any kind of lung issues at all recently?
Not that I know of, no.
Okay. Are you in any pain right now?
No, I'm not.
No pain.
No pain.
Okay. When you breathe?
No, just discomfort, it's not comfortable.
Okay. I want to ask you a few questions, if you don't mind. Are you allergic to any medicines?
No.
Do you have any kind of allergies?
No.
Any fever, food?
Maybe dust.
Dust?
Yes, maybe. Yes.
What set that off, your breathing difficulty?
Well, I was actually cleaning my attic, and afterwards I was starting to dust, and that's when I started feeling discomfort. 15 minutes later.
Were you wearing a mask at all?
No. Felt like I was suffocating after.
So how did you get here today?
Well, I was having trouble breathing, and my wife called the ambulance and took me to the ambulance, and they took me to the hospital.
Okay. Did they give you any medicine or anything?
Yes, they did. They gave me this thing I have in my nose. And
oxygen.
They gave me this breathing thing that I had to inhale.
Oh, so you squeezed and then you took a deep breath of it in?
Yeah.
Did that help?
Oh yes, it did.
Okay.
Oh yes.
Do you have any history of asthma in your family?
No, except for I think my grandma might have had asthma. She always seemed like she had trouble breathing, but I'm not sure.
Okay. All right, Carl. Well, I'm going to step out for a minute. I'll be right back. We'll get you on some. We'll get some treatment going for you as quickly as possible. Make sure you have your call light. Okay. And just give a ring if anything's going on. I'll be right back.
All right.
So what do we have here?
Patient is an 18-year-old male brought in to the ER with breathing difficulty. He says he felt like he was suffocating. Currently, his pulse is at 80, O2 saturation 95. He's on 2 liters of O2, nasal cannula. He has bilateral wheezing throughout lungs, percussed also, and heard some hyperresonance. His expiration phase is longer than his inspiration phase. He used an inhaler in the ambulance and said that helped. Currently short of breath, anxious, no history, and that's what we have.
Okay. Let's check him out. Okay, I'll order some tests and here, you can take care of this one. Thank you. Hey, Carl, how are you doing?
I'm good.
Okay, I checked your lung sounds and you have asthma.
Hello,
Hello, my name is Florentina. I'm going to be your nurse today. What is your name?
Carl Evans,
Date of birth?
August 1st, 1993.
Okay, very good. I heard you've been diagnosed with asthma. Do you have any questions?
Yes. What is asthma?
Asthma is a chronic inflammatory disease. That means your airways are constricted and it makes it difficult for you to breathe.
Oh, well. What causes asthma?
Asthma is caused by inflammation of the airways. There are certain things that can trigger asthma.
Like what?
Animals, pet, hair or dandruff, dust, mold, pollen, and tobacco. Do you find yourself around this a lot?
Well, I don't smoke. I don't have any pets. And the only time I'm around dust is when I'm actually cleaning.
Okay, that's good to know. You should try to avoid these things anyway, and when you're cleaning, please wear a mask.
Okay, great. But I have another question. What do I do when I have an asthma attack?
First, you should know the symptoms of the attack. These are wheezing, shortness of breath, coughing, and as soon as you find these symptoms, you should administer the albuterol.
Okay.
As prescribed. Sit upright and try to remain calm. If the symptoms do not get better or worsen, call 911.
Oh, man, that's a lot to take in.
I know. I'm going to leave you with some information that support groups will help you deal with asthma.
Thank you. Thank you very much.
You're welcome. Another nurse will come and will discuss with you about the inhaler. Okay?
All right.
Bye, Carl.
You have a good day.
Okay, this is going to be your inhaler. The first step is to prime your inhaler. To prime your inhaler, you're going to shake it up really good, and you're going to press it down just like that. You're going to prime your inhaler whenever your albuterol is a brand new prescription or whenever you haven't used it for at least 2 weeks. Okay? Next thing you're going to do is you're going to take a deep breath and you're going to exhale fully. Okay? And then you're going to put the inhaler up to your lips, put your lips around it and make sure it's secure around it. And as you're inhaling, you're going to press down on the canister, take a deep breath, try to hold it for 10 seconds before you slowly exhale.
Okay.
Okay?
Yes.
So let's see you try.
So I shake it up. If it's a new bottle, or I haven't used it in 2 weeks, I would prime it.
Very good.
Take a deep breath. Then I exhale to make sure that I have it, and I can't use it. And I need another 1 minute so I can use it again.
Very good. And then when you're done using the inhaler, be sure to rinse your mouth out.
Okay.
One more thing. After you used your albuterol, one of the side effects is that you might be a little shaky, a little nervous. That's expected, so don't let that freak you out or anything, okay?
Okay.
Do you have any other questions?
No, I think I'll do fine.
Okay, I'll be back later and we can practice one more time just to make sure you have it, but let me know if you need anything.
Okay,
All
thank
right,
you.
thanks. Hi, how are you?
And are you...
And if you can remove the can, well, let me get your eyes first. Can you remove your sunglasses, please? And just look straight ahead. Okay. If you could remove your glasses, please.
Oh, crap.
Here, know what you should do.